The rural areas of Ethiopia are extremely poor. Women face a spiral down to death. They have no access to health care. Without birth control, they give birth again and again. Without skilled assistance at the time of delivery, many die in childbirth, and many more are left with serious gynecologic complications of childbirth. My name is Margaret Muldrow, but everybody calls me Migs. I'm a dermatologist. I grew up in southwestern Ethiopia. When I was a child, we ran a clinic way out in the bush. And one day, a woman came in labor. She'd been in labor for multiple days, and she was in terrible pain. He put her on the single exam table that we had and found that the baby was dead and stuck in the birth canal. He pulled it through the birth canal. The woman thanked him for relieving her pain. They drank tea together, and then she died. And I never forgot that. It's probably why I became a physician, but also why we're working in women's health in Ethiopia today. We started the Village Health Partnership in 2010. We're a 501c3 nonprofit organization that works for safer motherhood in rural Ethiopia. Our mission is to prevent maternal and neonatal death in childbirth and to treat and prevent gynecologic complications of childbirth. We searched for a way to intervene in the crisis that women face in maternal health. We met Wachtoli. We found her in her hut waiting to die. She had a fistula and was incontinent of urine. She was severely debilitated. She could no longer care for herself and her family. And as an organization, we facilitated her treatment. So in treating Wachtoli, we sent a ripple effect through the community. We saved her life, we lifted up her family, and we benefited the entire community. Unfortunately, in the rural areas of Ethiopia, health facilities, if they exist at all, are deadly places to deliver. They're extremely unsanitary. There is no water. They don't sterilize instruments. Open defecation is common. They have no infrastructure for maternal health. And medical providers on the front lines don't have the skills to facilitate a safe delivery. We aim to create health systems of care that give women access to clean, safe, and effective health care. We have 3 areas of program focus. The first, we have a screen, transport, and treat program for women with gynecologic complications of childbirth. We identify the women in need in the rural areas, transport them to Ira Hospital where they undergo surgical treatment, and then we transport them home. The second program that we have is our water sanitation and hygiene and maternal health initiative. We've targeted 14 healthcare facilities in rural southwestern Ethiopia where we're implementing access to clean water, measures for sanitation and hygiene, and infrastructure for maternal health. And then our third program, we have education and training programs to create a strong, skilled, confident workforce on the front lines in rural Ethiopia. Our first education and training program, we provide village women with scholarships if they wish to become nurse midwives. The second program is our nurse midwife mentorship program. Nurse midwife trainers go out to each of 8 healthcare facilities 4 times a year to skill check and train nurse midwives on the spot. They also provide mentoring. If women are found not to have enough obstetric skills, we refer them to our third program where they get 3 weeks of intensive skill building in emergency maternal, obstetric, and neonatal care. All of our programs aim to build health systems of care that give women access to clean, safe, and effective health care at the time of delivery. It is our hope that one day mothers and babies won't die in childbirth and women won't suffer needlessly from gynecologic complications of childbirth. Your donation in any amount will enable us to continue to work for safer motherhood in rural Ethiopia and ultimately reach this goal. Thank you so very much for your support.